Great. So welcome everyone. Bienvenue tout le monde. For those who don't know me, I'll present myself. Je vais me présenter. Il y a quelques personnes peut-être qui ne me connaissent pas. Je m'appelle Faz Ahmed Khan. Je suis chercheur clinicien à l'Université McGill et au Centre universitaire de santé McGill. Je suis titulaire de la chaire de recherche nordique, l'Institut nordique du Québec, McGill. McGill University is situated on the traditional territory of the Kanien'kehá:ka in Tiohtià:ke, or Montreal, a place which has long served as a site of meeting and exchange amongst many First Nations. L'Université McGill est située sur le territoire du peuple Kanien'kehá:ka à Tiohtià:ke à Montréal, un territoire qui a longtemps servi de lieu de rencontres et d'échanges autochtones. Et c'est là où on fait notre présentation aujourd'hui. Donc, merci d'être ici. La présentation à laquelle vous assistez ce soir est co-présentée par l'Institut de recherche de la Centre universitaire de santé McGill et l'Institut nordique du Québec, ou l'INQ. L'INQ est un regroupement d'expertise québécoise dans le domaine de la recherche nordique et arctique. Il s'agit de 16 établissements universitaires québécois, plus de 90 entités de recherche, et 4 nations fondatrices autochtones, les Inuit, Cree, Inuit, and Abitibi-Témiscamingue. This evening's presentation is co-hosted by the Research Institute in McGill University Health Center and the l'Institut Nordique du Québec, or the INQ, which is a network of experts in the field of Northern and Arctic research and development. And the INQ consists of 16 Quebec universities, over 90 research centers, and counts amongst its founding members 4 of the province's Indigenous peoples, the Inuit, Cree, Inuit, and Naskapi. The INQ is focused on advancing knowledge on sustainable development with a specific application to the north of Quebec and circumpolar regions. And if you're interested in joining or participating in INQ activities, training opportunities, research financing, please feel free to send me an email afterwards. Donc, je partage une carte, et cette carte montre un vaste territoire dans la portion du nord du Québec, où l'Université McGill détient une responsabilité envers la population, de lui assurer un accès à des services de santé qui ne sont pas disponibles dans la région elle-même. Comme je dis, la présentation à laquelle vous assistez ce soir est la première d'une série organisée par la chaire de recherche nordique INQ McGill et le Comité sur le développement durable de l'INQ. Dans cette série de présentations, nous cherchons à mettre l'emphase sur des projets de recherche entrepris qui adressent la santé durable et des services de santé durable. Nous cherchons tout particulièrement à souligner des efforts de recherche effectués en partenariat avec les communautés autochtones pour adresser leurs soucis et les priorités qu'ils ont par rapport à ces thématiques. Donc, la leçon inaugurale qui va suivre a été choisie pour nous encourager à réfléchir sur les enjeux d'équité, de justice et de discrimination à l'intérieur du système de santé, avec comme prémisse de fond que ces enjeux doivent être adressés pour bâtir le socle d'un système de santé durable. So this map shows the territory whose population McGill University has a responsibility towards ensuring access to regionally unavailable medical services. And it covers a vast portion of northern Quebec. And over the next year, we're hoping to organize a joint lecture series by the INQ McGill Chair and the Committee on Sustainable Development of the INQ, where we're highlighting research undertaken to address topics related to sustainable health and sustainable health services. And in particular, we're trying to highlight research done in partnership with Indigenous communities that addresses their concerns and priorities. The inaugural lecture has been chosen to encourage us to reflect on equity, justice, and discrimination within health services, under the premise that these must be addressed as the foundation of sustainable healthcare. So it's a real pleasure to introduce our speaker, Patricia Bouchard. She's a graduate of the criminology program at the University of Ottawa. After completing a master's degree in criminology, she worked as a project manager and community worker at Calax L'Étoile du Nord in Val d'Or. In 2017, she joined a research team of the Public Inquiry Commission on Relations between Indigenous Peoples and certain public services in Quebec. In 2020, she began doctoral studies at the School of Indigenous Studies at the University of Quebec in Abitibi-Témiscamingue with Professor Susie Bazil. And together they co-authored a research report entitled Free and Informed Consent and Imposed Sterilizations of First Nations and Inuit Women in Quebec. That was published in November 2022, and which is the topic of today's lecture. So please welcome Patricia Bouchard.
Thank you. I will start sharing my screen. Can you see it? Yes, okay,
Yes.
perfect.
Yes.
Thank you. Thank you for this introduction again. I'm very pleased to be among you, even though it's online. So this presentation will be in English, but the period of question can be both in French and in English. So if you have question in French, please feel free to ask them in that language. Donc, la période de questions va être en anglais et en français. Donc, si vous êtes plus à l'aise de me poser une question en français, ça va me faire plaisir de vous répondre dans cette langue-là. For the plan of the presentation, I'm going to start with an acknowledgement. We're going to discuss the historical and contemporary perspective on imposed sterilization in Canada. We're going to talk about the context and the implementation of this research project. A few things about the methodology, then we'll dive into the results, the main finding, and the recommendation. The acknowledgement goes like this. To all the participants without whom this project could not have been undertaken, to those who have shown incredible courage in speaking their truth, to those who have honored us with their trust, we thank you from the depth of our hearts. We are discussing a very delicate matter today, and the fact that women were brave enough to come forward and share their story with us is something that is deeply humbling to me, Susie, and everyone in the research team. So that was why every presentation we do starts with this acknowledgement. Many people are uninformed about imposed sterilization and are perplexed by this practice and the degree of violence it entails. However, to this day, Indigenous women continue to see their rights severely violated in the context of gynecology and obstetric care. The extremely sensitive and upsetting testimonies collected in this research affirm the need to address this issue head-on. For any reason, if at any moment during the presentation it becomes too much, please feel free to log off and to listen to the recording later or come back to me with questions. I know it can be deeply unsettling and very rough to hear sometimes, but I think as mentioned, we need to address this issue head-on in Quebec. Imposed sterilization of Indigenous women in Canada. We did a big literature review on the subject before starting the PhD, and basically it all ties back to the eugenic movement. Eugenic people who were really preoccupied about being well-born, about the good stock of the race. When I use quotation marks, their words, not mine. Just to make sure. So the definition, as I just mentioned, means well-born. So basically, in their minds, some genetic traits or social traits could be transferred from the mother to the child, and they were really preoccupied with the reproduction of social ill and deviance, such as alcoholism, prostitution, and poverty. In their minds, they could curb these social issues by limiting the fertility of these women. So it was instrumentalized in medicine, in psychiatry, in social work, in criminology. I would like to say that these people were few and far between, but it's a movement that had really wide resonance all across the globe, and a lot of law, policies, and acts were implemented with this mindset. So they were really targeted for the control of their fertility, the selection of immigrants as well, and also the emission of marriage license. So all sorts of strategies were deployed by these the proponent of this movement. In Alberta, there was a law actually called the Sexual Sterilization Act from 1928 to 1972. It was the most active program in Canada that we know of so far. In British Columbia, it was called an Act Respecting Sexual Sterilization from 1933 to 1979. In Ontario, even though there was no law about sterilization, there is a phenomenon documented by the historian Licky de la Cour in her thesis. It is called sterilization by lock and key. So basically, Indigenous women who were at the Cobber Hospital near Toronto were facing a choice. And basically, they either agree to a tubal ligation and they can exit the facility, or if they refuse a tubal ligation, they will stay indefinitely confined within the walls of the institution because their fertility was really seen as a risk, basically. So this is only one study done in the whole province in Ontario, so we cannot generalize these findings, but I believe they were really, really interesting. According to the available data in Alberta, in Ontario, in Manitoba, and other places, there's an overrepresentation of Indigenous women among groups targeted by sterilization policies. And just to give you an idea of the, of the impact and of the mindset of the eugenists, I just took a little quote from a Supreme Court decision in the United States that is really infamous in this movement. Basically, it's the judge Oliver Wendell Holmes who said, "It is better for all the world if instead of waiting to execute degenerate offspring for crime or to let them starve for their imbecility, society can prevent those who are manifestly unfit from continuing their kind. 3 generations of imbecile are enough." There is many limitation to the study of imposed sterilization, in particular tracing and accessing archive. Those in British Columbia are either lost or have been destroyed. No one has been able to read them. No one has been able to analyze them that we know of. In Alberta, it's a bit different, but most of the archives were purged. So there were only 1 out of 5 files that were kept when they cleaned out the archives. So it's really touchy. And of course, there is a lot of laws that prevent researchers and people to access medical dossiers. So it's not very surprising. Another thing that I would like to point out is the absence of law doesn't mean the absence of imposed sterilization. It doesn't mean that these acts were not conducted in hospitals, in residential schools, in industrial schools, and places like that where vulnerable people were at the mercy, basically, of maybe directors and people that had eugenicist view. So a phenomenon that is now documented in all provinces and territories in Canada and now in Quebec as well. So if we go back in time, in 2015, there was a wave of denunciation in Saskatchewan, especially 4 Indigenous women who came forward in the news about the fact that they were pressured and coerced into accepting a tubal ligation while they were giving birth at the Royal Hospital in Saskatoon. A class action was launched in 2017, and we're still waiting to hear back about the authorization of this one. Since they came forward, a lot of other women shared similar stories all across Canada. And the federal government launched a committee on cultural competence that was also going to be examining the realities of coerced sterilization. But Quebec is the only province that refused to take part in it. They didn't even send someone to look over the procedures or anything. They said it doesn't exist in Quebec, and health is a provincial matter. So that was their stance. Suzy and Marjolaine Siwi from the First Nation Commission participated at the conference of the National Collaborating Center of Indigenous Health just right before the pandemic. And when they met with researchers, with survivors, they really said we need to do something about this issue in Quebec and offer the opportunity for Indigenous women in the province to express themselves on the matter, because there was no literature on the subject in Quebec. The only mention that I could find was that there is no data in Quebec. So that is why we were going in completely blind about this issue. The context also is the death of Mrs. Echaquan at Joliet Hospital in the awful circumstances that I'm sure you know of. She was subjected to violence and a lot of very discriminatory comments made towards her, and most of them were regarding the number of children that she had and in regards to her fertility. So these prejudices that were held by the eugenists like back in the days are still very much relevant today. The words may have changed, the tone may have changed, but the intention is still there. And as a part of the coroner's inquiry, it was revealed that Mrs. Chakwan had suffered obstetric violence. So we had the authorization from the family's lawyer and his spouse, Carole, to share this information. Carole Dubé testified about this experience, including how Echaquan had been pressured to undergo an abortion on more than one occasion, as well as a tubal ligation after the birth of their last child. When she died in September, their last child was 7 months old. Since then, Joy's principle is gaining ground. In summer 2021, when we launched the call for testimony, the discovery of unmarked graves sent shockwaves all across Canada, and it was something that how this is something very important and delicate that happened, and for many women who wanted to share their story with us, the context was just too much. So they said, yes, I have a story to tell, yes, I would be willing to share, but right now I'm so overwhelmed, I'm so distraught that everything going on in the news that I will not go forward. So this is why we talk about this broader context. In September 2021, the Bill 79, which is an act authorizing the communication of personal information to the families of Indigenous children who have disappeared or died following admission to an institution. So the most recent number are 200 children that are being investigated for the circumstances of their death, for the fact that they didn't die at the day that it was. So very important work that is being done there. It's an outcome of the National Inquiry into Missing and Murdered Indigenous Women in Girls final report, and we arrive with the very delicate subject of forced sterilization in the midst of all the very delicate issues. In September 2001, there was a broadcast of a report by Enquête about called "My Fertility Was Stolen." So women from Black communities in Montreal and also Indigenous women came forward denouncing the fact that they were subject to pressure and they were coerced into accepting a tubal ligation. At the time, the Prime Minister of Quebec said he finds it concerning and sad to see that many Indigenous people are poorly treated when they seek care in Quebec health establishment. Now it is zero tolerance, he replied during the press conference. And in October 2021, a class action suit was launched by 12 Atikamekw women at the Joliet Hospital. The class action was authorized in August 2023, and they are moving forward with it. So the objective of the research to make up for the lack of data on imposed sterilization of First Nation and Inuit women in Quebec specifically, to give the opportunity to share their story and give testimony in a context that respects the principles of research involving Indigenous people, document cases of imposed sterilization and obstetrical violence of First Nation and Inuit women. And we also believe that the absence of data was not a reliable indicator that this practice did not occur in Quebec. Steps of the research. So we had a cooperation agreement between the First Nation of Quebec and Labrador Health and Social Services Commission and UQAT, my university. Regional committee was created to basically oversee every step of the research. I will present to you the organization in the next slide. We developed all the different research instruments and we got the approval of the ethics committee of UQAT. Of course, we had special attention to the safety net for the participants because to make sure they stay in contact with us, to make sure we had all the directors of health and social services in the community made aware of this research was going on. So if they would receive a phone call, if they would receive a demand for psychological support, or else they would know what we are discussing. We launched a bilingual communication strategy in French and in English, but also there was radio intervention in Cree, in Inuit, in Atikamek, so many more languages spoken in the province. The data collection began in May 2021 and ended in January 2022. Then we conducted the first analysis of the data and the redaction of a preliminary report, and the final report and the validation of it came in the summer of 2022. The members of the original committee, Mrs. Debbie Delisle, who is an elder from the community of Kahnawake, the First Nation of Quebec and Labrador Health and Social Services Commission, Université de Québec en Abitibi-Témiscamingue, le regroupement des centres d'amitié autochtones du Québec, donc Friendship Centers, the Cree Board of Health and Social Services of James Bay, the Nunavik Regional Board of Health and Social Services, Quebec Native Women, the Assembly of First Nation Quebec Labrador Council of Elected Women, the Cree Women of UQAT, the Office of Senator Yvonne Boyer, who is a Métis senator who has been really a great activist on the national front to make this, to shed light on this very important issue, and the Dion Schulz Law Firm of Montreal. So the methodology, we prepared the call out and created the whole research material. We were really aware of the difficulties of the data collection because we were in the thick of COVID, so there was no opportunities for us to visit the communities. All of them were closed to outsiders in order to protect the elders and vulnerable people from the COVID outbreak. So all the interviews had to be done either on Zoom or on the phone. So that is also a big limitation. So the first phase was an interview with a retired Indigenous nurse. So her name is Jane Gray. She is from the community of Listigouge, and she would be the one behind the 8100 line and the general email. They would do a first interview with the participant, and if they wish to do so, they could do a second, more in-depth interview with me. The second phase of the interview was completely at their discretion, so there was no obligation to take part in the second one. We would make sure the safety net was around them. We would follow up a call after each interview, and each interview was also transcribed, codified, and a detailed analysis was made as well. So now to the results. 35 testimonies in total, 14 from the Atikamek Nation, 10 from the Innu Nation, 5 from the Anishinaabe, 4 from the EU, the Cree, and 2 from the Inuit. The age at the time of medical intervention, so the youngest participant to undergo a tubal ligation was 17 years old. The oldest was 46. The furthest in the past is the 1980s, and the most recent is 2019. At least 20 other women in Quebec who underwent imposed sterilization or another form of obstetrical violence were not able to participate in this research project for a variety of reasons. I mentioned them already, the fact that it is on Zoom, over the phone, the fact that it was a really heavy and delicate subject in the midst of everything that was happening in the news. So 35 is only the tip of the iceberg. So types of medical intervention and number of testimonies. So 9 testimonies are only regarding imposed sterilization, so tubal ligation or hysterectomy. 13 participants either had both situations happen to them, imposed sterilization and obstetric violence. 3 testimonies were about imposed abortion, which is something that we did not see coming. It just came up naturally during the interview. Obstetrical violence, 6 testimonies about that. So in regards to obstetrical violence, we're talking about action, attitudes, remark, and differential treatment, so being treated as less than other patients. And people who are witnesses, so people either in their professional career or in their family who were privy to certain acts regarding imposed sterilization or obstetrical violence. 5 cities came out strongly in the testimonies. Of course, there were others, but for confidentiality reason, we just focus on the main. So Robertval, Latuc, Val-d'Or, Joliette, and Sept-Îles. So places that are very distant from one another, but a lot of stories were eerily similar. So an Anishinaabe woman who was sterilized in Val-d'Or had a very similar story to an Inuit woman who was sterilized in Sept-Îles. So it's not the same hospital, it's not the same medical personnel that was there, of course, but the circumstances are very similar. So the majority of research participants were between the age of 17 and 33 when they were sterilized. So from a biological standpoint, as you know, the optimal time to bear children is between the age of 20 and 35. For 22 of the 35, so 63% of them, a tubal ligation was the only method of contraception proposed to them, regardless of their age and how many children that they had. Though they were not offered the pill, the IUD, the ring, or whatever method, it was only ever discussed tubal ligation. And in most of the cases as well, the tubal ligation was only discussed at the moment when they were giving birth. So there was no discussion during the pregnancy follow-up. There was no discussion about that before they started having contraction and such. So the subject of tubal ligation really came out of thin air for these women, and they didn't know much about this procedure either. So the sterilization were carried out in a hurry, often after childbirth, and it was never spoken during their prenatal care. And there was also no medical reason for carrying out this as an emergency procedure. So just the portrait of the 9 participants who had an impulse sterilization, I would just like to point out the last column here, the signed consent form. Since tubal ligation is an elective procedure, which means it is not required by the health condition of a patient, the consent form is mandatory. This is not just for record purposes. It is embedded in the law. You need consent form, and most of them, they did not sign anything agreeing to be sterilized. So that is really, really concerning. So then 13 testimonies, so 37% of the participants, and were regarding imposed sterilization and other obstetric violence. So for some, it was more like of a continuum, so different pregnancy, different incidents, and then culminating with an imposed sterilization. And for others, it all happened during one and only pregnancy. So very different. On the page in the report, it's page 43 and 44 to know more about the characteristic of these participants. And when it comes to imposed abortion, it was a shock to us when those testimonies were shared. We were not expecting it at all. It's women who were pressured, who were being told like very scary diagnosis with very little investigation. So they were just being told, oh, your child is gonna have a birth defect, or your child is gonna be born without a brain, and very, very alarming diagnosis. But when we would question them about that, there was no blood work, there was no scans, there was no investigation about that. It was only verbal intervention. So in their mind, this pressure and the fact that they were saying, oh, you're so young, you have other children, you don't have a stable life, and all these things conspired in them saying finally yes to an abortion, but when looking back on these circumstances, they say this wasn't voluntary. I didn't have all the information to give an informed consent to this procedure. I've included a few quotes also from the participants in the PowerPoint. So I would say such a difficult meeting for me, and I had to say yes then and there, but I was not capable of saying yes. I said, give me more time, I think about it. They answered, no, don't think about it too much. You just have to say yes. It was like they were insisting that I have an abortion. Then I was very convinced about having this abortion. Sometimes I regret having said yes, and I wouldn't want that to happen to other people. Then he described how the medical staff pressured his wife to have an abortion. Their child was born healthy. They urged her to get an abortion, to not carry the baby to term on the pretext that it was deformed. The main finding of the research are four: the undermining of patients' free and informed consent, the fear, distrust, and avoidance of health services, the differential treatment in hospital, the age of the patient, and the circumstances of their sterilization. So multiple violations of the right to free and informed consent were found in numerous testimonies. So first of all, the language barrier, because as you know, for many Indigenous people, French or English is their second language. And it might be okay when you hold an everyday conversation, but when it comes to the medical terminology and when it comes to the context where you are in labor, where you're in pain, when you've been given the epidural and other intervention, understanding English, understanding what it means, tubal ligation, many of them had no clue what it entails. So, and no interpreter was offered to any of the participants, even though this service was available at the hospital where they gave birth. Also, the absence of consent form is deeply troubling as well. Or some participants, they signed a blank consent form. So they were just said, sign at the bottom here, and then the information were filled out after. So they had no idea what they consented to, basically. It was, as I mentioned earlier, it was presented in a rush. They had no opportunity to ask questions, to ask a second opinion, to ask for alternatives. So they felt really pressured to say yes. A few of them also testified to the fact that the tubal ligation was carried out without their knowledge during their C-section. So it's a few months or a few years later that they see another doctor, and they're like, I don't understand why I'm having fertility issues and this and that they have the shock of their life to learn that they had a tubal ligation. So there's two very important overlapping issues: the lack of information and the very inadequate context in which this proposal was made to these women. I didn't sign anything agreeing to a tubal ligation. I was still doing fine. They decided to do it without my consent, without my signature. They did it during my C-section. They should be clear about what they're talking about. They need to make sure that the women understand the words they're using. Because personally, I had no idea what a hysterectomy was, and I didn't know these words. I never received any explanation about what the doctor was going to do to me. You were telling me earlier that it isn't always easy for you to understand French. Did this doctor ever suggest that you be assisted by an interpreter? No, never. I developed an infection, and the surgeon went to see me about 3 days after the surgery and said, well, while I wasn't there, I decided to take your uterus out. And that was the first I heard about it. So this lady, she was hospitalized because she had a bladder problem. So nothing to do with her reproductive organs. But I don't know what they did to me after I learned the DNC. You didn't have any other children after that? No. Did you have any other gynecological exam in the years that follow? Yes, I went to see a gynecologist. He told me that I had my tube ties, but I didn't know that I had my tube ties. I told him I wanted to have another child. This is also something that really that was really striking to us, is that these women, they said loud and clear that they wanted more children. They said loud and clear that they wanted to be pregnant again, or they wanted to have 6 children, and oftentimes they were told, oh, you already have 4, don't you think that's enough? So many derogatory comments like that were made. So the attending physician knew that these women wanted to be pregnant again and have another child, but they nonetheless they chose to propose to them the tubal ligation. The fear, the distrust, and the avoidance of health services. So at each and every of their deliveries, there was incidents of violence, whether it's attitudes, whether it's looks, whether it's the way they were not treated as well. So for patients who were women who were in pain, who didn't have access to the proper medication, who were deliberately ignored by medical staff, even though they were in distress. So there's a very important cumulative effect to all of that. The fact that they learn about their sterilization months or years later is also a deep, deep shock. Um, for most of them, they totally refuse to go see doctors. They refuse to go to the hospital unless they are on the verge at doorstep, basically. We also documented, as I just mentioned, the violence in the non-fact, in the non-assistance, and the willful ignorance. So these patients were in pain. They needed pain medicine. They needed assistance and care and in consideration, and they didn't get any. That's what comes out strongly in their testimony. And as a result, they have not consulted for years. This woman, she's talking about her daughter. Every time she gave birth, she had a C-section. I had to go. She didn't know why I wanted to be there. I had to be there. I was worried. I don't know what they're going to do to her. Even though things have changed today, it's still worrying. I was kind of always scared going to the clinic. First time when I had my baby, there was no records. How do you say? My pregnancy was not recorded in any clinic because of being afraid, because I had a friend who was older than me who had a baby, but her baby passed away a few months after. I don't know what happened. So she's the one who spoke to me about the clinic, which is why I was scared to go there. I was scared, so I never went there when I was pregnant. The differential treatment in hospital, they really feel and they see that they are being considered as second-class patients. They're not treated with the same care, with the same respect, with the same consideration as other patients. It feels like they are frequently targeted by prejudice, stereotypes, and degrading remarks. So they are really labeled as problematic patient, neglectful mothers. So a lot of comments are made towards the fact that they have too many children, that they won't be able to care for them, that they use drugs, that they are single mothers and such. And these comments are very recurrent and persistent. So as a few examples, she was asked at each visit if she wanted her true size. This became a weekly question at each visit. She said she was not interested. As the due date got closer, she was seeing the doctor 2 or 3 times a week, and she was always asked the same question. Some participants heard remarks about new mothers when they were in the hospital, such as her again, she should have her tube tied, all her children should be taken away from her, etc. He told me, we're going to perform a tubal ligation. I said, nope, I don't want that. I don't want to have a tubal ligation. I want to have more children later. Don't you think that you've already had enough? It's enough. You need to stop there. All the children that you will bring into the world will live in misery. My God. The same lady said, you aren't treated like a person, a human being. You're treated like a savage, a dirty Indian who is going to my comments. Those are the sorts of remarks I heard when giving birth. It wasn't easy. It was my second child. I was young. I was about 20 years old. And sure, I didn't have a stable life exactly, but I kept my children. Then when I gave birth, the doctor told me, you should stop having children because they'll end up in foster care. That's what happened with Indians. You need to put an end to it now. Then he said, there's an opening in the afternoon. You're lucky. Lucky, eh? Lucky to have my tube side. I would have liked to be treated the same as non-Indigenous patients because I could already see when I was in the reading room, I could already see the racism. The age of the patients and the circumstances of their sterilization is also deeply troubling. Between early adulthood and the mid-30s, the majority of them had no medical condition related to pregnancy or childbirth, so they were perfectly capable to be healthy during their pregnancy and deliver a very healthy baby as well. There was no diagnosis, there was there was nothing in their medical file that could justify this intervention being done so soon. And also, they clearly expressed the wish to have more children, and they were able to do so. Some of them had a hysterectomy at a very young age, and they were never given any hormonal treatment. So now they have significant bone and dental problem because of the bone density. So one lady, she says her teeth are just like crystal, and same goes with her bones. She never got any follow-up after the hysterectomy. She didn't know she would have a very, very abrupt menopause. So she was left in the dark about all of this. And of course, there is the lack of information and discussion on non-permanent contraceptive methods. It didn't help me more than that because, at my age, at the age that I was when I had the hysterectomy, I considered myself young. I considered myself too young to be given only this one option. I never had a child after that, and I always ask myself that question: why can I do it? Why? What did they do to me? Did they cut me? Did they tie me? I don't know. I have no idea what they did to me. Maybe they did something inside me that I don't know. That's all I have to say. That's everything I went through. It was very hard. So after analyzing the testimonies gathered for this research project and comparing them with the conclusions of recent research on the issues faced by First Nation and Inuit in public services in Quebec, it is clear that all this research converges on the same finding: the presence of systemic racism. Another participant shared how the anger she felt following the death of Joyce Chacuan motivated her to contact the research team and to speak out so that such an incident does not happen again. I was really shocked by what they did. When I think about what they did to this woman, they killed this woman. And what we experienced too, it was really racist there. I really wasn't comfortable there. One participant stated during her interview that she would be willing to join a class action suit if people started one. I think that if there's enough of us, I think that I would be willing to testify. Hopefully, at my age, I would be taken seriously. So several points of convergence and similarities between different testimony, even though it didn't happen in the same region of Quebec, even though these women have never met one another, even though it's different hospitals, they're, as I mentioned earlier, very irregular situation. It's reported all throughout the province, as I mentioned, from the 1980s to 2019. So this is a very current issue. And there's a continuum of different types of violence, obstetrical and gynecological violence experienced by them during their visits to Quebec Hospital. And also there is a double standard in regard to tubal ligation. A lot of women in Quebec came forward because they said they wanted to have a tubal ligation, even though they were in their 30s or their 20s, because they were sure they didn't want to be pregnant, they didn't want any hormonal methods and such. And they had to go through so many hoops and so many difficulties in order to finally get the tubal ligation. So it seems that First Nation and Inuit women are on a fast track to get this procedure, but when it comes to white Quebecois women, it seems that it is much more complicated and difficult to access this procedure. In total, in the report, we made 31 recommendations for First Nation and Inuit institutions, governments, and professional order. Most were proposed by the participants, some by the research team, and they are within the scope of education, sanction, data collection, and in continuity with the recommendation of other inquiries. So the website here that I present is where you can find the report. You can find all the relevant information regarding this research, the declaration of commitment of the FNQL, the press review, the contact details of Susie, my thesis director, and myself as well. The research outcomes. So when the report came out in November 2022, the media coverage was something, I would say. Susie and I did not did not expect that at all, and we were quite taken by surprise. So more than 70 article, web, radio, and TV reports in various countries. The creation of a working group within the College of Physicians of Quebec. The report, this presentation that I just did, was presented to more than 30 organizations and university courses and seminar. We were invited this fall in Greenland also to present this research during social health summit, and also in front of the Public Inquiry Commission in Greenland about both sterilization. It's very different in that country, but I won't go into details here. We are also participating in a research with UQAM on obstetrical violence. There is the bill S-250 that is now at the third reading at the Senate about the criminalization of sterilization. And there's work underway in Greenland and in Vermont to shed light on their birth control policies, because in Greenland, it took a different form. In Greenland, it is called the spiral scandal. So this is the shape of the IUD at the time. So it's a contraception campaign that was led by Danish authorities that were really going through the school and really targeting young Inuit women. So they were subjected to an IUD insertion without consent or explanation. So they estimate that 4,500 Inuit girls were fitted with IUD in this way. They estimate also that the Greenlandic population was reduced by half. So this IUD was inserted to them without their knowledge. And as you know, an IUD is not made to be inside a woman for dozens and dozens of years. So many health issues resulting. A lot of women were sterile because of that. And it is documented also that they used the biggest IUD model available to make sure that these women would not become pregnant. So there was a national survey that was launched in May of 2023 and scheduled to end in May 2025, the Public Inquiry Commission that I mentioned earlier. And as of now, 143 women are suing the Danish state for compensation. So it's still ongoing. So there should be a lot of development in that regard in the next few months. But also many of the survivors are today very old, or some of them are dead. There's an important, because it's a Public Inquiry Commission, they can go in the archives as well, so they have access to other documentation that as researcher we cannot go through. So it's a very different context, but just to give you an example of this type of policies all across the world. In the news, I don't know if some of you have watched the télésérie. I don't know. I don't know the word in English, but the télésérie Stats. There was among the many intrigues of this TV show was an Indigenous woman who underwent imposed sterilization. So she was called Alison Picard. She was played by Katia Rock, who is an actor and musician. So this episode aired on January 25. So if you would like to see the arc of this lady, of the story of this lady, you can look it up. There was an interview with Susie in the magazine Chatelaine, and there is also a scenario that is being written right now by Geneviève Albert, Marie-André Gill, and Kim Oben-Sawin about imposed sterilization. For now, the title is Death Metal. So we'll see. They had the funding to write the scenario, and maybe, hopefully, fingers crossed, it will make it to the big screen. And wait. There was also an article in The Lancet that you can download online called Confronting Medical Colonialism and Obstetric Violence in Canada. It was written by one of your colleagues at McGill, Dr. Samir Shaheen Hussein, and by, what's her name? Alyssa Lombard, who is also the woman representing, the lawyer representing the woman in the class action in Saskatchewan. So you can find it easily online. A lot of women came forward after the publication of the report saying that they too had a story to share. And the First Nation authorities, when we presented to them the report, clearly asked us to continue this research. So on July 17, 2023, we started the second data collection, and we were now able to go into the communities. So we traveled all across the province in the last few months. We added a few more teams in the interviews, such as sanatorium, because a few Indigenous women who came back from sanatorium were never able to have children after that. So it's something we are looking into. Birth alerts as well. Same goes with blood samples of newborns without the consent of the parents, thinking they are made because they believe the mom has been drinking or has been taking drugs. So as I said, we traveled extensively in the last few months. We just finished the data collection, and we are now doing the whole data analysis and the writing of the next report. So it should be published in the next few months. So there will be a follow-up to this big project. So voila, I could have spoken to you about this very important subject for hours. So this is just an overview. If you'd like to read and download the report, it is online. And voila, thank you for listening to me. And if you have any questions, feel free to open your mic or ask in the chat, and I will do my best to answer. Thank you very much.
Thank you very, very much, Patricia. Merci beaucoup. That was it was riveting. It was chilling, and it was also inspiring in terms of an example of how research can be used to try to advance, I guess, the cause of justice for Indigenous people in Quebec. There's some hands up, so I'll just do a bit of moderating. So first we have Professor Marilyn Ahun. Go ahead, Marilyn.
Thank you, Faz. Thank you so much, Patricia, for this really great work and your time and effort in shedding light on these stories. I missed a bit of the beginning of the presentation, so I apologize if you already talked about this, but given in light of these reports and this information that's now been shared and made public with the Quebec government, are they still resistant to acknowledging the reality of what is going on in Quebec? Are they now more open to trying to resolve and address these issues, or have they still continued to be quite resistant?
At the government level, you mean?
Yes, the government of Quebec.
We are still facing the denial of the main conclusion of the report, which is systemic racism. They do not like this word. They do not want to acknowledge this word and this reality. So this is the stance that they are taking so far. There has been, when the report was launched, there was a few reactions from the Minister of Justice and from Minister of Indigenous Affairs, but so far they have not announced anything concrete when it comes to this very important issue. The Collège des Médecins was way more proactive, I would say, on the topic, with the launching of the working group and all the actions that will be announced in the next few months. So I think this is where we are at right now with the collaboration with the government. They have received the reports. Some of them have read it. We had a few comments, but there's still this very, very thick wall of denials, and that says systemic. This is nothing. They keep mentioning that this is nothing systemic, and so this is where we are at, unfortunately.
I was worried that was going to be your answer. Thank you very much for
I wish I
sharing.
had better news, but nope.
Professor Stenbeck?
Yes, thank you very much, Dr. Can. I'm Marianne Stenbeck. I'm a professor at McGill, but I'm also the Canadian correspondent for Radio Greenland. So I followed the case in Greenland very, very closely. And I know Susie Basil has been to Greenland several times. And I know people in Greenland have been very much inspired by your work at UQAT. So your work is really reaching out. I have a couple of questions. My first question is the Quebec victims, for lack of a better word, are they also suing the government or the hospitals or anybody right now?
For now, there is only one class action active in Quebec regarding the Joliette Hospital. 12 Atikamekw women have joined, but for now, we haven't heard of any other action regarding other hospitals or other regions. So they were suing the doctors and also the hospitals, but the judge that gave the authorization only allowed for pursuing the doctors and not the institution. So right now they are contesting this decision in court. They decided to appeal the decision and in order to have this decision reversed. So they're like, as you know, the justice system doesn't work very, very fast in Quebec. So who knows when this appeal is going to be heard and if it's going to be enlarged to the hospital as well.
I was also very interested. You talked about, I think it was Bill 79, 199 children. Have any of the corpses actually been disinterred yet? Have they actually found the corpses, or is it just images?
I think for now, because they only started their work very recently and there was the pandemic and it is such a very delicate subject, but I know that there has been 2 exhumations in Quebec that really, one of them, they were able to say, to identify the child, and the other one, we don't have, the information is not public yet. They just released a report about the progress of the work being done under S 69. So you could find it online, and the Association Awashak also is really involved doing the grassroots work on this very important issue. Right.
Okay, thank you. My final question, Dr. Can, what is your email address? I want to email you about certain things. Could you put it in maybe in the chat or something?
Sure, yes, I'll
Thank
put
you
it
very
in the chat.
much. And thank you, Patricia. It was a great, great presentation.
Thank you.
If there's no other questions, I'll ask one question I had. So I think this was a great example of using research to bring to light something quite important that needed to be identified and studied. And my question is there a role for research, not just of the Indigenous people or the experience this, but of the population that continues to perpetuate this, to understand, how exactly does systemic racism get perpetuated in highly professional cultures with ethical standards they're supposed to be that we are supposed to be adhering to. Do you think there's a role of research to study, I guess you would say the majority, that by the majority I mean the sort of the society that perpetuates this on Indigenous peoples?
I think I would answer your question in a more broad way, because the first recommendation of the report is to listen and believe First Nation and Inuit women when they come forward with stories like this. Because a lot of women, they were intimately convinced that no one would believe them, that it was their story against against a doctor, and we all know all those powers dynamic goes. So for years they kept silent about these very important issues. And obstetrical violence, it's only been 20 years that we talk about this subject, huh? Because a lot of women were told, but you know what, your baby's healthy, so why why are you going back and forth on what happened during your delivery? Why should it matter? But now, of course, we do know it matters. So I think as researcher, we need to make a space for these very delicate experiences that don't fit in the common narrative of what is it to give birth, huh? Because every time this fairy tale is sold to us, oh, this baby gonna arrive and everything's gonna be picture perfect and you're gonna dress him in linen and blah blah blah. And when in fact it can be very traumatic, it can be very difficult, and there can be a lot of instances of violence in the delivery room. So to open up the space to talk about that openly, to have the opportunity for support, for understanding, and for listening, I think way before research, as human beings, that's the sense that we can have. Even though some people, I've talked to many doctors about the research, and some of them, they have the funniest reaction. They were like, oh, so there is a serial abortionist going around in Quebec and targeting Indigenous women. I was like, huh? Like, he could not wrap his mind around it at all. And he was like, oh, this must be a very old school doctor. It's like, no, it was not. How come? And it was so like up in the air when I talked about the research. So maybe challenge our own prejudice, challenge our own vision about what it means to be a mother, and who has the right to have children. Who should bear children? How should they bear children? And also support initiatives when it comes to building capacities for midwives, for birthing in the territory. I know a lot of work is being done in Nunavik and in EUHG. I'm sure you're aware of it, but support those initiatives and shed light on them as researcher to see that this is also a valid way to do health, to do medicine, to do care and consideration for Indigenous patients. I think that would be my answer.
Thank you. Thanks very much for the presentation, and please also give our thanks to Professor Basile, who's doing such amazing work in the province. Thanks everyone for joining and sticking around, and your great questions. Have a good evening.